Good afternoon, everyone. Good afternoon. We are at the top of the hour, so we politely ask everyone to find a seat. We are so grateful for your presence here today. And in just a moment, Commissioner Richardson will come and bring greetings on behalf of her office. So thank you all again. Hello? Good afternoon, absolutely. How many of you all are excited about all the resources that Cobb has to offer for mental health? I just feel so blessed and honored to be able to play a small role in helping bring us together to have this very important conversation. I am the District 2 Commissioner for Cobb County, and I have with me the District 1 Commissioner as well. And we're actually in her area. This is District 1, and one of the best senior centers. I don't know if there's rivalries that exist between them, but certainly if you haven't been over here, you should take a visit. And really just grateful for everyone that decided to participate as panelists, bringing the resources out. And we're here for one goal, and that's making sure that everyone knows what resources are available and that they have ample opportunity to take advantage of those resources. Because none of us should feel alone, ever. And we know we just came out of COVID, which is it's testing all over. It was testing our patience, it was testing our sanity, our ability to cope with unique situations for our families. I don't want anyone to feel alone. We are not walking that path by ourselves, but we are walking together. And so with that, I would like to have Commissioner Gamble say a few words as well.
Thank you, Commissioner Richardson, and thank you for hosting this event. And I'm glad to see everybody here, and I hope we learn a lot. Thank you.
Good afternoon again. So great to see you all. My name is Irene Martin. I have the pleasure of serving as the Executive Director of the Cobb Collaborative. We're the Georgia Family Connection partner serving our community. We convene stakeholders to address critical issues facing our community, and mental health has been an issue for quite some time, actually pre-pandemic. And so we are grateful for the partnership with Commissioner Richardson's office. This is actually the second town hall that we have held. We held one back in September that focused on youth, and we are so pleased to be able to partner once again, and this time focus on our senior community. I hope each of you have a program that's a front and back flyer. We have such a distinguished panel of subject matter experts with us today, and you will see their very impressive credentials on the back of your program, your flyer. We're not going to take the time to read about all of them, but it is impressive, so I know you will join me in just receiving lots of information and being hopefully connected to not only information, but resources and other assets right here in Cobb County. So let's just dive right in. You're here to learn and to be connected. Thank you. Donna, if you don't have a flyer, please raise your hand. And I do want to express my gratitude to Donna Court. She and I together planned this event, and Donna is part of Commissioner Richardson's community cabinet focused on the senior population. Donna is a nurse by professional and has such a caring heart for her community. So again, if you need an additional flyer, or if you would like to take one back to a coworker or neighbor, please feel free. And also, please recognize that we have our exhibitors listed on the front of that. So, all right, let's get started. Let's get to know our panelists as they introduce themselves and give us a little bit of a window into their world. So, panelists, I'm just going to start here and work our way down. I'm going to ask each of you to introduce yourself and then talk about how you interface with the senior population. And if you could also talk about the most common mental health conditions that you see as you perform that service.
Hi, I'm Delbert. I'm a licensed clinical social worker and owner of Mindful Transitions. And our practice is primarily older adult focused mental health. I interface with seniors directly as I have clients, but also consulting with families and then supervising my own staff who's working directly with older adults. But I've been in the field about 22 years now, mostly older adult focused. What was I supposed to answer?
The most common mental health conditions.
The most common mental health. Okay, depression, anxiety, grief, grief and loss are really prominent for us. And also just kind of adjustment to many of the transitions that occur in the older years. So new medical diagnoses, needs to move, losses of family members, believe it or not, losses of adult children. So lots of grief, depression, and anxiety is primarily what we see. Also mild cognitive impairment as well.
Thank you, Laura. Dawn?
Aloha. My name is Dawn Reed. I'm the owner of Aloha to Senior Solutions and the founder of Aloha to Aging. I interface with seniors both on a caregiver support group as well as care coaching, those that come to our adult day respite, so those that might have some cognitive impairment or a physical challenge. But the caregivers themselves, I think, are the big target. We do see a lot of depression. I mean, basically exactly what she just said. The only thing I'd add, in addition to the depression and anxiety, is we do see a lot of undiagnosed bipolar and manic depressive.
Hi, I'm Dr. Janna Williams. Can y'all hear me? I'm not here with my. Okay, I think can y'all hear me okay? No? We're multitasking today. Okay, great. So I'm Dr. Janna Williams. I'm a lady who can't hear me.
How many specialists does it take? Apparently 4. So I'm Dr. Janna Williams Pitts. I'm a licensed psychologist. I'm the primary care behavioral health lead with Wealth Star. So I work in a primary care office. I work in a primary care office. Quite to me for see that it got really loud. This is really weird. Okay. So I work in a primary care office at Kennesaw Medical Center with 4 physicians, 2 nurse practitioners, and a physician's assistant. About 60% of my referral base is working with older adults. The most common diagnoses I treat, I support patients who are experiencing grief and loss, and then also support patients who are experiencing caregiver burnout. So just see kind of a wide range of things. I'm happy to be here.
Try this one. That was good, wasn't it? So I always start off by saying the most difficult thing about me is my name. And so I always have to tell people how to say it. So it's like a baton, what you twirl, but with a J. We're gonna practice it. Jaton, there we go. All right, good. Well, I'm excited to be here as well today. I am the Director of Senior Services for Cobb County. So I'm actually gonna share a little bit differently of what I deal with seniors, and that is more of the side where we deal with how they act, their social well-being, their interactions with other seniors. So we have an active center. We have seniors that are coming here because they want to be around other people, and they have the opportunity to react and interact with each other. So on our side, we're doing the social well-being part of it. I deal with staff that are working with seniors on a daily basis in all the centers. We provide transportation, so I won't get into all that, but make sure you pick up one of these before you leave. Make sure you have that so you can see what resources we offer. And I have been in the field of caregiving, which is what I wrote my paper on for my PhD. How does stress affect the caregiver? And it was based more on the knowledge of the caregiver when dealing with whatever the issue is they're dealing with the older adult. So that's how I was connected, and I the more and more I think about it, I've been a caregiver since I was about 8 years old. But it was at a fun time because we were helping with my great-grandmother. And what we had to do, we had to move her around the house. So she was in a wheelchair, so that was fun for us because we were just zooming her through the house. But we didn't know that we were actually helping my grandmother with her. It was fun for us, but that's actually where I started. And how do we do that better to keep our older adults independent? That is our goal and focus here at Senior Services. And I have one little thing. I tried to pen a cute little poem because I was looking at what can I say that connects all of us. So I wrote something, and I'll share it really quickly, and it's called I Have Something to Tell You. I have something to tell you. Sometimes I think of things from years ago. I don't remember all the details, but what I do know, I can't show. There are things I keep inside my head. Some days it's a lot of thoughts, some days it's a few. That's why I know I have something to tell you. Come sit with me. Listen to what I know, because those things are so powerful that I just can't let them go. What are they? They are my thoughts. Thoughts about me, thoughts about you. But what can I do? I want to tell my friends. I want to tell my family. But what will they think? I'm not really sure. So I close that mental door to break that link. Is this what I should do? Because you don't see my mental pain? I don't know. I just shut down because I'm ashamed. Think of my mental health when you say, how is your day? I don't want to answer with something untrue because I really do have something to tell you.
Thank you so much for grounding us, Dr. Gibson. So I'd like to start by doing maybe a little deeper dive into depression. I believe that's the most commonly occurring mental health condition across all populations, across all ages in America, and particularly for our senior population. Mental Health of America notes that about a quarter of the people who experience a stroke end up with clinical depression. We also have those who have lost a spouse or a significant other, and several of you mentioned that you help people deal with loss that can transcribe into depression. And from a very personal standpoint, I will tell you that when I lost my father 7 years ago, I also lost the person that my mother was when she was his wife, so it impacts the next generation as well as my, at the time, preteens. We also know that approximately 68% of adults age 65 and over know little or nothing about depression. That's what Mental Health of America tells us. So Dr. Gibson, I'd like to start with you, and then we'll just work our way back down the table if everybody is comfortable with that. And just can you help us kind of frame our conversation a little bit more about depression, warning signs, what you all see, If you would like to go ahead and get into resources, that's fine. That was a common theme in the comments that people submitted that we're going to attend today.
Okay, I will start. And I think I'll grab stroke because I just experienced that with my mother. In May of 21, she experienced a stroke. And so one of the things that we were trying to do and to make sure that she stayed engaged, again, I have to reference the senior centers. Mobility is one of the things that you lose that will depress you mostly, because then you lose your independence. So when we're talking about depression, I'm going to link it to independence or becoming dependent, the lack of mobility, and the lack of communication. So when those things move, and we can all reference COVID and how we lost some of our ability to communicate with others. We had the opportunity to introduce a lot of technology based on that to try to curb some of the depression. It was just, even with us, a lot of the staff, and I have to wave at all of them because they're here, but thank you so much. To connect to people that were not being connected in their homes. So the depression on that end, and I'm just referencing COVID because it's still real and it's still, like, we're still dealing with some of the things from it. And now we're getting the seniors back into the centers, and we're seeing a difference in how they're acting, even since they've come back on site. So some of the warning signs that we saw, they were not as active as they were before they went home, because we did close for a while. The conversations were not as robust with other seniors. And if you remember what I said in the poem, that there were things they wanted to discuss, really not quite sure how to discuss it. So there's a difference too in loneliness and isolation. Loneliness is what you feel, right? So I can measure isolation. I can measure how long you've been in your house, how long it's been since you spoke to somebody. It's really difficult to measure your loneliness because, again, that's left up to you to share even with yourself, if you were lonely, and gauge how lonely you really were. So those things will lead to depression as far as having the communication and ability to be with others. And I'll go back to my mom, and we affectionately call her the Pearl. Some of the things that she shared with us as an 86-year-old that has experienced a stroke, and how we as her children have helped her through that, because we became even more engaged with her. And it's to introduce her to new things as well. We were able to record her and put her in some events where she could see herself on television, and it was amazing to her, and so we're fooling with technology as our age, but introducing it to her at her age, and so there was that connection, and it made her feel like we kept her involved. So that's the other thing about depression. If you see some of those warning signs where people are retracting away from things that they used to do, they're no longer excited about things they used to be excited about, have a conversation. And some of the times I think we all need to be taught how to have that conversation, because we can go at it the wrong way and cause even a greater divide.
Well, sometimes we rely on this to communicate, and that might not work with all generations, right?
You are correct.
The other doctor?
So I'm going to pass it. So you all saw that I was able to.
There we go.
Let's see.
Yeah.
Let's see if it works. That's what we need to start with you first. I'm so glad that you mentioned leaning in to your relationship with your mother. I was just looking at a study that showed that for older adults, yes, there was an increased rate of depression during the pandemic, but for older adults who strengthened their relationship, there was not as increased, and compared to those who did not strengthen their relationship, the increase in regards to the severity of the depression wasn't as high for those older adults who were strengthening their family and their community relationships. So relationships are key, and with the pandemic, being really creative and aware of different modalities of connecting. So I'm really glad that you mentioned that, you all leaned in and really strengthened those connections. You also mentioned independence, and there was an increase in the unemployment rate for older adults as of April 2020, so it's a little bit behind, but from 2% to 15% rate unemployment. And you talk about independence, and you talk about the ability for older adults who want to be in the workforce, who were told to, starting early in the pandemic, we were made aware that older adults were more likely to experience more severe illness, an increased likelihood of experiencing death due to COVID-19. So that population was encouraged to isolate earliest and had to leave the workforce. Some were pushed out of the workforce. I had quite a few patients who came to me with depressive symptoms because they were forced out of their jobs and they weren't planning to retire for another 3 years. And so it was, how do you wrap your head around experiencing ageism, which is very real. And so we talked about identifying other options around part-time work. We talked about budgeting. We talked about identifying what's most meaningful and important to her. It's an acceptance and community and commitment therapy strategy, just really connecting with her values and just sitting and listening about her experience with ageism, because it was her first experience. I'm thinking of a specific patient in mind. So there's that piece around independence, and for older adults who want to be able to return to the workforce, I hope we might maybe talk about some options that are available within the local community. I did find there's a senior community service program with the state of Georgia, and there's a link for that to be able to help older adults transition back into the workforce if you were required to retire earlier than you wanted to due to the pandemic. In regards to signs and symptoms of depression, functioning is really key. So if you have a friend or a family member and you know what for them their norm is around their schedule, and you notice a change in that, checking in and saying, hey, you used to walk at the park twice a week and you haven't been doing that as much. What's going on? That's an example of how to kind of check in, but that does require knowing what that daily schedule looks like for your family members and for yourself, being connected with, okay, what's my norm and how can I tell when something is shifting, and who might be my support to kind of hold me accountable with that and check in with me on that. Also, just lack of interest in enjoyable activities. When you hear folks saying, I really used to enjoy doing this, but it's just not fun anymore. Someone's talking about things just not being fun anymore. That's a sign of depression as well. Increased tearfulness, and then also insomnia. So I mentioned that's one of the most common referrals I see. If someone's talking about, I just haven't been sleeping well, you might recommend that they talk with their primary care provider about that, because insomnia can definitely, the relationship between insomnia and depression, it kind of can go back and forth. So with insomnia, it can sometimes trigger a depressive episode, but a depressive episode can also trigger an episode of insomnia. So those are some of the things that kind of stood out for me.
Thank you. Dawn?
Okay. So I'm going to give you two different perspectives, one from volunteers and caregivers, family caregivers, and even those paid caregivers, and then the care recipient. So what we saw, the depression became kind of rampant, and it affected people different ways, especially if we're looking at care recipients and volunteers. Doing what I'm doing, we're volunteer-based, and we work a lot with caregivers, family caregivers, as well as paid staff. And what we saw was we all want to be purposeful, and that purpose changed because of the isolation. We couldn't go visit those that we loved. We couldn't do the job we wanted to do. We couldn't volunteer and help those that we wanted to. So we actually, the term pivot, we definitely pivoted literally immediately and just did kind of a touch base with all of them and said, what is it that you need? So we actually did some virtual training with a psychologist We did everything from essential oils to meditation, just looking at some other varied opportunities that maybe people haven't done before. And I think because it was virtual, they felt that they were safe and in their homes, and they were less vulnerable actually, and they were more open to these alternative options for helping with depression. So there's that component. Personally, my mom was in assisted living, and she was getting physical therapy and walking with a walker. That isolation, because she could no longer do physical therapy, she's no longer walking and she's bedbound. So for me, it was huge transition, just personally as well as professionally. And that sense of depression for those that were caring for her, to see her independence and the loss of independence was pretty sharp. So we look at that component. So care recipients, so my mom, she challenged all of us to kind of think outside the box and help her in a way now that she's bedbound, and she's done a beautiful job with that. But it's mainly because we know enough what to look for and what to do and what the resources are. Making sure that we're getting the home health, the PT, the speech, all those different, making sure she's getting massaged and turned, and all those different things that are critical. The other care, I would say the care recipients, we had the adult day program that we do. We had a waiting list when COVID hit. And now to get that ramped back up, so many of the people that were on that waiting list that we served, they declined enough so that they're no longer appropriate for our program. So we saw a huge transition with isolation. And I will say we're all still coming out from that. Depression, the stigma of depression is so real. When we do caregiver support groups, just yesterday I did an assessment on a family that was going to be joining our Aloha Day Club. And the minute we allowed the husband to go into the program, she just looked at me and started bawling, crying. The transition of seeing her husband go from her husband, who was a doctor here in East Cobb, to now having dementia and coming to an adult day respite is heavy. And so we try and really work with them, give them different resources, not only that are up here, but also we do an aging simulation to try and get people to fully understand what it's like to possibly have cognitive loss, as well as physical, hearing loss, vision loss, neuropathy. Education is key, and I think a lot of times we're in denial. Well, that's just how mom was. That's just how dad is. And the truth of the matter is that's not always the case. So I think, talking with the doctors, but educating and going to the different support groups and listening to the different resources that are available, which I know we're going to get into, but that are in the room are critical to our own well-being, to our neighbors and our family as well.
In terms of the depression that we have seen pre-COVID, all of our services were mobile to a client's home. So we would go into an assisted living and we would go into their home. And let me tell you, when I walk into a home, I can tell whether there's any kind of mental illness, not in a I'm here to judge your home kind of way, but in a that mail hasn't been opened in 3 months kind of way. And those are the things that we could see when we worked in people's homes. But with COVID, when everything flipped to telehealth, we sort of had one arm tied behind our back as we tried to assess and do our work. But we know with older adults that there are certain patterns that we often see related to depression and some of the other illnesses. And so we often heard more complaints of vague pain. Everything hurt more in places that were hard to describe. Lots more aches and pains, joint pains. So we saw or heard about a lot more physical pain. We also heard a whole lot of negative thinking and speech. So, I think it's important that we talk about the stigma of mental illness in general and caregivers, maybe not feeling comfortable talking about that, but having those discussions and asking really genuinely, how are you and what does that mean, is what elicits those conversations. And that's when you hear the negative thoughts. Well, I just can't do that. It's too much. I don't feel like it anymore. And as soon as you hear those things, all right, now we're watching for other signs and symptoms. We're watching for sleep. We're watching for appetite. We're watching for energy level. We're watching for, loss of interest and engagement, just like all of the other panelists have kind of touched on. For our process, we have to be fairly diagnostic in terms of meeting medical necessity criteria because of who pays for our services. And so we're kind of mentally going down a checklist in our brain of the medical necessity criteria. And so I think it's important to have those discussions and ask those questions and be genuine when you ask the question, and then wait and be silent. Because I think the other thing that we do is that we sometimes ask the question and the answer makes us uncomfortable and the fear of what's coming makes us uncomfortable. So then we just keep talking and fill the space, which does not help your older adult who has something to say feel comfortable to say it. And so I think, to one of the other points the panelists made, noticing what's different and asking about it, and then pausing is key, because that's where we've heard what we've heard. But definitely the isolation from COVID has contributed significantly, just all around, and we are still seeing the effects of that. I think we will for some time to come, honestly. What we haven't seen fully yet is the onslaught of all of the people who've been keeping us afloat this whole time. And the onslaught of their symptoms, I believe, is coming to, the first responders and everything that they've seen. So I think our job is to keep our eyes and ears open and listen and ask questions and then pause for the answer.
So as each of you have answered that question, and I thank you so much for sharing such great information, the symptoms of depression in the older community are really not that dissimilar from other age groups. Disengagement, sleep patterns, used to be very involved in this, and now I can't, I won't, and it looks like it wants to comment on that. Dr. Gibson, you want to hand that over?
You got it.
And can we just say that this is stressful when you're doing that, right? Like that's
A lot of pressure right now with this microphone. I'm so glad that you pointed that out. So something that is unique with the older adult community in depression is cognitive changes. So then you're wondering if, okay, is this mild cognitive impairment? Is this dementia, especially if there's a family history of Alzheimer's dementia? So if you notice, and a family member, or if you yourself notice that maybe you're kind of more forgetful than normal, or maybe you missed an event or an appointment, it's something to pay attention to, because it could be a sign of depressive symptoms. It could be a sign of mild cognitive impairment. It could be a sign of the normative process that we experience as we age and as our brain ages. But ultimately, that's an excellent question to ask your primary care provider, who can then refer you to a neuropsychologist to do an evaluation. And a neuropsychologist has a battery of assessments that they'll conduct with the patient. They'll do an interview with family members, like with their spouse or adult child, if the adult child is engaged in your care and treatment process. And then at the end of that process, they'll provide a diagnosis and they'll make specific treatment recommendations, which is a little bit different than working with a neurologist. So if you notice cognitive changes, that is definitely a great opportunity to talk with your primary care provider and say, hey, I'm noticing this. Can you help kind of guide me forward with next steps?
Thank you, Dr. Pitts. Dawn?
Okay. I think dementia is a confusing term too. I mean, I think people, when we think of depression and then we think of dementia and mild cognitive impairment, the mixed dementia, Alzheimer's, frontal temporal, Lewy body. There's so many different dementias that are out there. But 1 in 14 over the age of 65 have some sort of dementia. And then that increases after 80, it's 1 in 6. So I think you add that in addition to one of the things we haven't mentioned that I know you're all going to agree with is medication mismanagement. So when you have the 6 doctors, you've got the cardiologist, you've got the neurologist, you've got, the multiple doctors that a person has. The unfortunate thing is oftentimes, especially that age group of 70 and over, they're going to believe whatever the doctor says, how many doctors that is. And so that's unfortunate because really we have to make sure that they're going to the same pharmacist and then have that pharmacist review all those medications on a regular basis and making sure that all that medication is updated in the house instead of having all the medications from 10 years ago, 5 years ago, 2 months ago's issue, right, that they didn't finish. So I think that's the other piece that goes along with the depression and some cognitive challenges as well.
And Laura wants to chime in too. Yes.
Oh, see what you did. Let's try. She messed it up. Okay, what I wanted was just to say to caregivers, your best friend as a caregiver is a pharmacist, okay? Because you're gonna go to several doctors, but the thing when you aren't concerned, if you see a change after a week or so of taking medications, or you can't figure it out, or there's some things you don't understand about the medication, your best friend as a caregiver, a person that's trying to make sure the medications are filled, you're giving them properly. And I think I'm pretty smart. And we even got confused with my mom's medication because we had morning medications and afternoon medications, right? And then the afternoon medications had to be cut. So we had to half those. And I'm thinking, well, why don't you just half them before you get them to us? So then the half medication, I didn't know the medication had not been half. I gave it to my mom, and my niece came in and she said, what did you just do? And I said, well, I gave her medicine. I can read. All wrong because I didn't pick up the evening pill. I picked up the morning pill. So it's a lot of things that you have to do even in the home when you get the person, if you're providing that type of care. But what I was saying about the pharmacist, which is so glad she did, they know more about the medication and how the interactions happen with all these different medications that you give me. So form a relationship with your pharmacist. That's what I wanted to say.
And something else too, is that when we generally see our clients weekly, sometimes we see them less frequently than that, but often we're the one that the family calls and says, Mom is not the same as she was 2 days ago, and we don't know what to do because we're a trusted provider with the family and they're used to talking to us about any changes with Mom. And one of the things that we suggest first and foremost is a quick trip to the primary care. Because one of the things that we've seen happen more frequently than I wish would happen is that there's an infection of some kind, usually urinary tract, especially if it's ladies, and they have incontinence issues because the products are unbearably expensive, and many times, you push them as long as you can wear them, and that creates dangerous infections. Many times, ladies are not drinking enough water either. This happens with gentlemen too, but I'm just saying. The most recent case that came to me was a lady, and when she went to the primary care to say, whoa, my brain is not right, I don't forget things like this, the first thing he did was give her a urinalysis and then an antibiotic. So, and that was the source of her cognitive change. So most people are afraid to talk to their doctors about the cognitive change, I think because of the stigma and, oh gosh, do I have Alzheimer's? But maybe you have a urinary tract infection and we could resolve this whole matter in less than 2 weeks. And then your brain is back to where it needs to be. So I always, if you see a sudden change like that in your cognition that you're worried about, primary care is the very first place to start so they can rule out any medical infection right away.
Thank you very much. So you've touched on this a little bit, and I'd like to maybe go a little bit deeper, if you'll permit us. And one of you mentioned, you have the cardiologist, the 6 different doctors, and you may have a kidney issue. And so I know I learned this when my father was in what we now know as last months, is when that renal doctor comes in, he or she sees 2 kidneys. When the cardiologist is in, he or she sees the heart. When the GI person, they see that. But you need that overall perspective, which sometimes a primary care physician can play. Sometimes your pharmacist can help you. But I think that we tend to separate mental health over here, and then physical health is subdivided into all of these subsegments, if you will. Can we talk about why that is, how we can address it? Is it different for the older population than it is for younger? I see all kinds of head movements. So ladies, I'm just gonna, who wants to dive in? Maybe Dr. Pitts, do you want to take a stab at this first? Kick us off.
Get the microphone.
Yeah, it's the mic.
Okay. We're gonna
Claim it, okay. All right, so that is an excellent question. I think there is, from a systemic standpoint, healthcare has a ways to go here, unfortunately, because there are, with WellStar, and so sometimes I'll have patients who have specialists who are with other systems, and we can access. So in regards to the electronic health record, now it's such that we can access those notes with other specialists for some other health systems, but for others, not so much. And so it can make it a bit tricky from that standpoint to be able to kind of reconcile that. In regards to the mind-body connection, I mean, it's huge. We know, substantial reports that folks who have clinical depression, depressive disorder, and if it's untreated, their health, diabetes management, chronic disease management, their health outcomes are poor. Their health outcomes are poor. So we know that addressing mental health conditions, it's going to be who have untreated depression, have the motivation to be able to take their medications daily, to attend follow-up appointments, however, if those symptoms are well treated, then the patient is going to be more likely to attend to their chronic disease management. So that linkage is very significant. It really is.
Dr. Gibson?
Yes.
We're going to get this right. One thing that we do when we talk about the difference in physical and mental health, we prepare a lot of people, and most people, how to age physically. It's very difficult, as we've spoken about, having the conversation about how do you age mentally? How do you help yourself age better mentally? We talk about exercising, right? We know all these different routines that we can do. We know that we need to eat better foods. But do we say read more? How much do we talk about that? It's difficult to have those conversations once, and I'm going to say you're in the throes of it, or when a person is already experiencing those things, because now I'm going to actually have a little bit more reluctancy to listen to you, because wait a minute. Should follow is earlier with everything else is to do it earlier. Those things that do to strengthen us mentally.
Thank you. I love that. We pay so much attention to the physical, but then, and Dawn, your organization plays a key role in that, right?
I hope so. I did also want to just bring up too anticipatory grief. So I think when we think of grief, we think of after loss. Or just before somebody's dying. But anticipatory grief can happen actually when you're retiring and you're lost purpose. You're just kind of like, okay, where am I? What do I do with my life right now? That also can happen when I'm 80. and just saying, okay, I can no longer walk my 3 miles like I used to do or cook like I used to do. So you realize that it's one loss after another. And I think that also plays a big role. When you look at the amount of medications, 7 to 10, I think are average for most seniors. And so they don't want to take that one more pill. Plus they want to be strong during this. They don't want to have to deal with it. And I'm okay. I'm okay that I'm sleeping, 5 hours a day and the additional. So I think that's part of it, but I think it also starts really a lot younger than we maybe are realizing. So it's almost like we have to do it in the workforce as well. This training and understanding of mental health, not when it's too late. So.
Just on the point of, mental health not being integrated with physical health, we're not integrated at all. And we have so far to come in terms of our health systems. And I think my patients that have the best outcomes, the reason they have the best outcomes is because that they have an advocate. They have an advocate who says, I don't understand these instructions that the doctor just gave me. They have an advocate who calls the pharmacy and makes sense of what needs cut in half and why it wasn't cut in half. And sometimes those advocates are paid advocates who are used to coordinating within the healthcare system. And sometimes those advocates are adult children who are learning on the job. And sometimes, there's a nurse in your family and that's really helpful. And then sometimes there's not. And so I think that those that tend to have the best health outcomes have an advocate who goes along for those appointments, even if you're going to remember everything that your doctor said, but having your daughter stop and get the medicine on the way home so that you don't have to go back out and wait 3 days to start something. I mean, even something as simple as that will improve your health outcomes by 2 days. If we go back to the example I had earlier about the UTI, think about the difference of, starting a 7-day antibiotic 2 days earlier. It matters to have someone coordinating these other pieces for you and making sure that you understand, because the health system is probably not going to do it. There are a lot of systems, just like she was saying, that don't talk to each other. They can't talk to each other, but there are people who work across the systems who are used to making Wellstar talk to Emory to talk to Piedmont. And those are the people that also are really helpful to have in your corner.
So we can have a really deep policy discussion on why is it that people need an advocate to have better health outcomes, but we can't tackle that here today. That's going to be a week-long seminar somewhere. But I would like to, because I know in my role, I get these calls. I'm concerned about my neighbor. He is all alone and he does not have family here. I'm sure you see this, and you all have talked about your personal experiences, how fortunate your parents and people in your lives are to have you champion for them. But what about the people who don't? And we live, our society now, it's nothing to live 500 miles away from mom, 1,000 miles across the country. How do you address that? And I know that's a loaded question. We can talk, I think it was Dawn who mentioned knowing your neighbor's patterns, if you take a daily walk at 2 p.m. or something like that. But I tossed that pretty heavy question out there.
No one wants to.
No one wants to.
Because it is loaded.
Yeah, it's loaded, but it is reality, right? That we have people who are by themselves.
Yeah, so again, I'll to try to get this one to work. I think I'm, so what the terminology for that is called a long distance caregiver, right? So it can be a family member or it could be someone here that communicates with the family member. And I want to add this point before I go into specifically answering that question. As we're aging, it's important that people know you prior to aging, because some things you like to do that may present as a sign or a warning sign. For instance, sleeping. I'm a sleeper. I like to sleep. And if you didn't know that, and I'm, now at this point I'm 70 and I'm still liking to sleep, you may think I'm depressed. No, I like to sleep. So knowing the person previously, or getting someone to give you information about the person, that's a different thing as well. What I want to say about that, senior services for Cobb County, and I know that's next to our thing, but I think we're actually talking about resources and how you connect. The staff at senior services is amazing for Cobb County. We do get a lot of calls and we do refer people out, and that's why we know pretty much everybody in the county that we can use as a resource. But for us, I will say our prized resource would be our staff because they know and they connect. And we're always trying to figure out where's that partner that we don't know, what is that service that we're not offering. And we actually spend a lot of time talking with the seniors in the center saying, what is it that you're looking for that we're not offering? What can we do? And that's how this actually is so amazing that we're hosting it here. And again, to both commissioners, Richardson and Gambrell, thank you again for supporting this, because this is very important. In Cobb County, and I do this when I talk, I ask, do you think it's over 100,000 people in Cobb County over the age of 60? Is that a yes or a no? What do you think? So do you think you all have enough voice to make sure that we find the resources and the things that you all need to make your lives first independent as long as possible, and then as easy as possible? So that's one of the things at Cobb Senior Services. Again, I show our pamphlet because we have a lot of those things in there. That's transportation, it's meals, it's care managers, which we have social workers on staff. We have care managers that are going to reach out to you and get that question. If we don't know it, we will keep calling until we find it. And more than likely, it's one of the people around the room or somebody on the stage that can help us connect you where you need to be. But I think it's all about connections and communication.
Thank you, I love that. I want to continue the conversation about resources, but it's just about time to hear from you all. We have some questions that were submitted ahead of time. But if you have a question here, if you would raise your hand, we have some index cards that Donna will hand you. If you don't have a pen, we can help you with that. And so we'll take some questions from the audience as well. We didn't want to be passing a mic and all of that, given the fact that we're not completely out of a pandemic. So we'll do it this way, and hopefully we'll be able to make that work and get everybody's questions answered. Dawn, I think you were going to speak next.
Well, I just want to say, I think there's a lot of great free resources out there, but it needs to be a collaborative effort. And that's what Irene and I were on a call the other night, and there's just so many resources. It's overwhelming for a long distance caregiver. Where do I go? Which website do I go to? So we were like, gosh, wouldn't it be great if we could have a one-stop shop where it's like, here you go. And there is, I won't put the Empower line. I mean, there are several out there, but I would say one of the key things, whether you're a long distance caregiver or a local caregiver, I can't, say strongly enough about how important it is to go to a caregiver support group. And it's an overall caregiver support group. And I think I encourage people to go to as many as they can, wherever they can, whether it's online or in person, because every time you go to one of those, you're going to learn something a little bit new. And it's just a beautiful gift, whether you're going to need an elder attorney. And I didn't even think about that because they just moved. I just moved mom. I'm thinking their will's good. Well, no, it's not that you moved them. Whether it's a financial advisor, or whether it's a senior services, transportation, whether it's care options, all of those different things. It's a beautiful gift to be able to be amongst other people. And also, when we go back to the emotional component of that, it normalizes your feelings, because oftentimes when you are a caregiver, you're angry. The anger really is there many times when we do this, the grief, the sadness, and just the feeling, the anxiety, and the overwhelming of where do I begin. And so I think it's taken it step by step, but also just being in the room. I've had it where people don't say anything. They wait till the third time they come, and then it's just, okay, I have 10 questions. So I think that's an important piece for people to understand, that's out there, and it's free.
And both Dr. Gibson and Don touched on this, but I'd like to just go ahead and address this question that was submitted ahead of time because it does get into the resource issue. Is there a dedicated site to find out information about senior mental health in Cobb County for assistance with caretaking, daytime/nighttime care facilities, specialty doctors, and general information on the best kind of diets, physical health, just like all of the above? Okay, Don's going to start us, and then maybe Dr. Gibson, you look for shore and resources.
So the Atlanta Regional Commission has what's called the Empower line, and
Yes. Because these are the Empower line.
The Empower line.
We are all in there. It's a beautiful resource that has, it really, I mean, that is a one-stop shop to a degree, right?
to a degree. Okay, so that is a great resource.
They are updating it regularly. The other thing I did just want to mention, when we go back to the doctor's visits, the multiple doctor's visits, and especially if you want caregiving, if you are in a caregiving situation where there's multiple siblings or multiple people that want to be part of that caregiving situation, one of the things I strongly encourage whoever is going to that doctor's visit, whether it's a caregiver, a family member, or friend, we all have cell phones, and all those cell phones have a voice recorder. And you just say to that doctor, listen, I have to report to a lot of different people about this visit, so I'm gonna just report this, okay? So let's know in advance, so that everything you're saying is right there, and then you can play that back to whether it's virtually or on the phone. But that way you don't have to worry about what he said, and then you're fighting on the way home about that, that's right. That's a beautiful gift, and again, that's free, so something just to, your own doctor's visits, but obviously, especially if you're caregiving with
Thank you. I think Brian's trying to help us out with the mic, but.
Okay, here it is. The one thing I wanted to share about Cobb, we, pre-COVID, we were starting an idea, some staff members and I sat down and came up with called the 100 CAN, C-A-N, okay? That's the 100 resources in Cobb County. It's called the Cobb Aging Network. We still have that on the book. At an event somewhat like this. So we came up with 100 aging network resources in Cobb County. And then once COVID hit and we had to stop that. But that is still on our books to have that. And so that would be one thing that we would actually list on our website. And as you mentioned, the Atlanta Regional Commission is also the next best place where you can find most of that information. Now, you can't get upset because you may get funneled out to someone else, but we make all efforts, as well as the Atlanta Regional Commission, to connect you. And it may not actually be in Cobb, but if we can't find it in Cobb, we can find it.
Excellent, thank you. Lauren?
I just want to add that the Empower line, you can both search it online, and if you prefer to speak to an actual person, you can call and speak with an actual person who will sort the resources for you. You just talk to them on the phone like we used to do. And so you don't have to do it online if that's not your favorite way.
Also wanted to add the Area Agency on Aging. If you have a zip code, so even if you have a family member in another state and you're trying to work with them, the n4a.org, in capital, small n, 4, and the letter A is an apple, .org. You can put in anybody's zip code in the U.S. and they will connect you to somebody that you can call in that area. So I want to share, even though I know we're in Cobb and I know you all have family members and you have friends that have family members in other states and areas, even in Georgia. put the zip code in. If you can get that, you can kind of narrow down what the resources are in that area.
Great, thank you, Dr. Gibson. And that's, N is in Nancy, and then the numeral 4?
Correct.
Okay. And then A, okay. Dr. Gibson, don't put that mic down. Question from the audience. How can I engage Cobb Senior Services to support a senior needing multiple services? Do you offer case management?
We do. Is anyone here? Oh, there she is. She is actually, LaTronda, will you please stand? She is my go-to. She is actually, watch what I say, okay? Follow me on this. She is the manager of the care managers. She is always available. I sometimes send her things late at night when I get them, very responsive. She can connect you to an individual that will make sure you get a phone call, and they will work with you until we figure out what it is you need and how we can get you connected to. So we have a group. How many? 5? 5, and LaTronda is the manager for it. So she is here today. If you need to speak to her specifically after we finish, she should be in the back and available, and she will share her information with you. And if you ever need to call, again, where's my brochure? My assistant to my right, she took them. But make sure you pick one of these up. The numbers that you need specific to senior services are in this pamphlet. And there's one in there, 5355. I know that one. That's the first number I think I learned when I started working here. They can get you to wherever you need to be, but make sure you grab one of these, okay? My sister. We're right fine. This one is in English, and that one is actually written this Spanish. So we have 2 versions. If you need to get some of these to take back to your facility or wherever you are, make sure you grab some of those.
Thank you. There were several questions that were submitted ahead of time about mental health and the Medicare program. And that would again be an entire day session or things like that. And so we're not here to talk about Medicare, but I believe that team of case managers can start making some connections, and maybe Dawn and Laura, your services work in that space as well.
Yes, we are traditional Medicare providers. One of the things that we are seeing sort of system-wide, because remember we said that the system is not particularly efficient with behavioral health, is that behavioral health providers in general are not all taking all the insurances. And so it can be really tricky to find help. But I would encourage you, regardless of what your insurance is, whether it's traditional Medicare, whether you have an Advantage or replacement plan, the number on the back of your insurance card is always a fine place to start. Now you may, pack a lunch and be ready to hold for a minute because, you are calling a large corporate entity with some hold time. But, grab your paper, grab some water, and you can find mental health resources who specifically will accept your insurance. Our practice takes traditional Medicare. We don't take any of the replacement Advantage plans. But there are some providers who do. I don't know if they're local to your home. But yeah, it is becoming a little bit more difficult to find a provider who takes this specific insurance or that specific insurance. So if you're not sure, always start with the number on the back of your insurance card. Or if you're web savvy, you can go to their website to search for a provider as well.
Thank you. Dr. Pitts?
One of the benefits of having behavioral health integration is I'm credentialed with everyone, which unfortunately behavioral health providers who are in private practice, it's more of a complex process. So this is why integration is so important. It really can increase access to behavioral health services. A website that I frequently use is psychologytoday.com, and a patient can go in and put in, or anyone can go in and put in the city where they live, they can put in the specific diagnosis, they can put in their insurance, and find a list of providers that accept their insurance. The only challenge is sometimes they'll put not accepting new patients, sometimes they won't. So again, it is a process of, preparing to you're going to have a list of providers that you might be calling and kind of interviewing to see if they're the best fit or seeing if they're accepting patients currently. But that's a really helpful resource to use.
Perfect,
Could you
thank you.
repeat that name?
Psychologytoday.com.
And the good thing, I want to thank Cobb Government Communications team. This recording is going to be on the county's YouTube channel, and then we will also follow up with the Commissioner's office to make sure that we shared all these great websites and phone numbers and things like that that are being shared.
So we're a little different. We're a therapeutically structured adult day respite versus the medical model. So medical models are usually covered underneath Medicare, and we refer people out to those because we're just a part-time adult day respite. But what we do have, we partner with the two local foundations, the LMK Foundation and Jewish Family and Career Services. Both currently are providing funding for the day respite, as well as in-home care. And I think, again, those little nuggets that are so important, and oftentimes people might look at the stigma of something and say, I don't qualify. Well, it's not necessarily income-based, nor do you have to be a certain religious affiliation to qualify. So again, those little nuggets are really important to share.
Excellent, thank you. I think we answered this one, but I want to honor it. Most seniors are taking multiple medications without the prescriber doing any research on their current medications. Can multiple medications have an effect on an older adult's mental health? The answer is yes. So if you have anything else to add to that. But here's another one, because we've been talking a lot about the importance of having an advocate, but that can be stressful. Sometimes hospital workers, just because they are overwhelmed, don't always have the ability or the time to really listen, and sometimes there's a language barrier. Any thoughts, suggestions, resources in that space?
Pick up the phone and do the Google Translator. I mean, I'm laughing, but it's true. I mean, we do that quite a bit because that's the only thing that's going to be able to get you being able to speak with somebody that doesn't speak your language. And for example, our day respite right now, we've got somebody from France, somebody from Poland, somebody from Korea. So there is that language barrier, and oftentimes with dementia, they revert back to their native language. So that could be additionally difficult, especially if the children don't know that language.
And I just want to, I recall when I had the demonstration about caption call with Claire, that there are different languages available on your system, right? Okay, and hopefully more to come. So, but that is another resource. So thank you, Dawn, for lifting that up. Any words, and Dr. Pitts, you're in this space perhaps more than any of our other panelists, about the stress on our medical team, and when you feel like someone is hurrying you along or not really listening to your concerns about your parent or the person that you're there with.
So are you speaking, you said hurrying you along, could you
Well,
elaborate a little bit more?
The question was, sometimes hospital workers don't always listen when you are there trying to advocate for your loved one, your relative, your friend.
That is true, yep. So I would really recommend assertive communication and kindness and compassion. You put it out, you're gonna get it back. And if you don't, with WellStar, we have, I don't wanna say that it's like they have like patient advocates, patient engagement advocates. So if you've tried the assertive communication, if you've tried the compassion, if you've tried the kindness, then the system needs to hear about what's going on, and we care about what's going on. So ask for that patient engagement advocate and make your voice heard, because we take that feedback. And I will say, in regards to WellStar, in regards to nurturing the workforce, we all had a year subscription to Headspace for us to nurture our mental health. The providers also got a pass to be able to access different like local community parks and to be able to go to Lake Sweetwater, we had a pass. So our system is really engaged in nurturing the medical providers, to the MAs, to the nursing staff, to the behavioral health providers. So I think the system is really invested in that part, and caring for us isn't as much of a concern as having your needs supported. So please, like if you try the kindness and the compassion and asserting yourself, and it just doesn't go through, please reach out to a patient advocate, because we want to hear about those experiences so we can get better.
Dr. Gibson, you'd like to weigh in?
Yes, I do. So prior to becoming a person working in community health, I worked in the hospital for 10 years. And this is actually what even gave me more of motivation to work with older adults. And it's a term called health literacy. Health literacy. And that is me understanding what you're telling me and being able to say, I don't understand it. That is more powerful than walking away and guessing. Saying, I don't understand it, and you can look up health literacy. That's information given to you, and you're able to hear it, understand it, and make a decision based on what you heard that's good for you or your family member. So that's really important for caregivers as well as the patient. It's health literacy. But the thing is, when we go anywhere and we're not comfortable, or we don't understand, or we don't feel that people are being patient with us, and I'll just throw this back, what should you do?
This is the audience participation.
That's the audience question. Communicate. As you're saying, I don't understand it. But if we walk away not understanding it, we don't share that, then how do they know it? So if I'm with Dr. Pitts and I'm telling her, I don't say anything, I'm nodding. I'm nodding the entire time I'm in there. Again, back to being an advocate for yourself or the caregiver or the person with you, being an advocate for you. It is sometimes difficult to change doctors or to change from the place where you go. But if you're not comfortable there, you do stress yourself when you leave because you have no clue what happened. You don't understand it. Now you're home alone and still trying to figure it out. So advocate for yourself by understanding.
I have a quick question.
For me?
Yeah, just real quick. What about if the doctor is not, you don't agree with what she's saying? She's not listening to you. She doesn't hear you. She's coming up with an answer that you don't agree with. When you're telling her what your symptom is, she's saying, oh, that's not what it is. I'm like, you don't get it.
So if she's not getting it, I'll share it, then they may want to weigh in. If you are not comfortable with what she's telling you, she could be right. But if you're not comfortable with her, that's your physician, and you continue to go, who will probably be the person that's upset after the end of the sit down? You are. So that's your decision to make though. You're being a patient, you don't agree with her, you have to figure out, am I gonna keep going to her because I don't agree with what she's telling me? Again, I say she might be right, but it's you, and you have to be comfortable with what you're being told. And then you make a decision based on, okay, am I gonna go back to her or do I need to find somebody else? Then you go to the second person, they say the same thing. Then you say, okay, so that's when you get into second opinions, and some people, my dad, he was a third and fourth opinion guy. But it's based on how you feel. You have to be, and that goes back to that mental stability of saying, okay, I'm good with that person. I trust her. I'll go back to her. I had a physician, I did not agree with him initially, but the more and more we talked about it, he explained to me a little bit different. And then he said, okay, you may need to educate yourself on some of these things. Go do that. And our conversation got better because he shared other resources with me.
Well, speaking of other resources, I do want to share that Donna reminded me, and going back to, I think it was Laura's comment on the back of your insurance card, most of your major carriers have translation services available, paid staff that can help in the native language or the language that the patient or the designated caregiver is most comfortable in. So thank you, Donna.
And it's for free.
And it's
And
free,
they have
yes.
case managers.
And
for
yes.
free. It's on the back of the card.
All right, we are close to wrapping up here. This is an interesting question, and I did not know that the ADA has officially recognized long-haul COVID symptoms, but many doctors do not. Suggestions for seniors with long COVID. a system, that sounds like a system type of issue?
That's a really great question, because ultimately, I think it kind of comes back to advocacy, and speaking specifically with, if your medical provider doesn't recognize or acknowledge long-haul COVID, then maybe speaking from a system, like a symptom standpoint, and these are the symptoms that I'm experiencing. So what types of interventions might you recommend to improve my functioning? Because I think you'd be hard pressed to find a physician who doesn't agree that they want their patients to have optimal functioning. So if we're talking about from a functional standpoint, I find myself being curious about if that might be a way to frame that conversation, but I don't know.
June?
Well, first of all,
Ms. Van Rackle. I'll be forward.
I want to thank Commissioner Richardson and Commissioner Kelly Gamble for having this event. I wish I had more of my group here, but I want to piggyback on what Dr. Gibson said about health literacy. I have, in talking to our seniors, we have found that there's some kind of cultural differences, and sometimes how they approach the doctors and how the doctors approach them, that they feel very uncomfortable. So they're not going to go the next step, follow up with this disillusion, not knowing what to do and what to say. I've experienced it myself, but I'm not allowed, so. But I do realize that the seniors that we talked to, well, I went there and I tried to explain it to them, and they just looked at me like if I didn't know what I was talking about. And this is more common than you realize, especially for seniors in a different generation of 75 and older. And because they come from a different way of interacting with their medical professions and with the hospitals. So we would like to know how can we help in helping our seniors understand how they need to react to these doctors, and also about advocacy, because the first thing I tell them to call the patient advocate.
Yeah.
Those are some things that we would.
Super, thank you. There's different variations of the same question that came in ahead of time about where should we go first for mental health. And I'm going to say, look around the room and gather resources if you didn't have a chance already. NAMI Cobb has a helpline, an assistance line right here for Cobb County. It's not intended to be an emergency line. It is staffed by volunteers during the workday, but that is a stop. Obviously, Dr. Gibson talked about Cobb Senior Services and the case managers. And there are the supervisor of those in the room, as well as other staff people. And I also want to mention they have COVID tests there. Alana, please, she wanted me to be sure to say that. We have Highland Rivers CSB that is often the first stop that some people need to take in terms of getting answers for mental health or getting connected with resources. We have Stephen with DBHDD, the GCAL access line that can also connect with resources. So please know that we have those kind of first stop emergency type of resources here, right here in the room, and we will of course be sharing those. There was a question as we wrap up about income-based housing, which would be yet another day-long, week-long conversation. We all understand and appreciate the affordable or the lack of affordable housing for our seniors and for really many, many people in our community. I'm going to suggest starting with a case manager. Is that okay, Dr. Gibson? Start there, but also talk to other folks here, because as you know, they all have networks and things like that. So I appreciate the question. There are resources. I would suggest starting with the case manager at Cobb Senior Services the first. How about joining me in giving our panelists a huge hand? And I'd like to invite Commissioner Richardson to come back up and close us out. I hope you've enjoyed. Please make a point to stop back by the booths if you didn't have a chance to grab information. Thank you all. Commissioner? What a fantastic job. I just want to see a show of hands. How many of you learned something new? Excellent. That's all we set out to do today, is to make sure that you walked away with some new information that was empowering. To be honest, that patient advocacy question was mine, so I appreciate your answer on that. I know if you've ever had a sick grandparent, sick parent, you've experienced it, and it's certainly an issue that needs to be addressed. But I did want to just close us out by saying some really big thank yous. You know, Irene, I'm going to start with you at Cobb Collaborative. Just an exceptional job. We're so We're really just grateful for the partnership. You partnered not just on this town hall for seniors, but also on the town hall for youth. And I know that there are aspirations to continue to do some additional ones. So just grateful to have you in the community and for all the work that you all do. It is so appreciated. Also wanted to say thank you to staff. So Dr. Gibson is here as well, but there are other members from Senior Services Center that are here, and just appreciate all of the work that you're doing every day to serve a sizable population within the county. So thank you so much for that. This is our family, it's our heritage that we're trying to take care of, and thank you. Comms, doing a fantastic job, always doing a fantastic job around the clock. Our communications department with the pictures, the video, the live stream, just really a thank you to you as well. Don't know if the Sheriff's Department is still here. Cobb PD was here as well. Appreciated their presence and participation and their commitment to mental health across the board through partnerships with some of these organizations and internally supplying resources for mental health within their facilities. And so very grateful for that. And then I have the personal liberty of thanking my office staff and my cabinet. If you all would just stand in front here, we've got Leah, Shweta, Abigail, we have Donna, who is on the cabinet, and this is a part of one of the projects she's helping manifest. Louisa, who was on the cabinet, and this started with really early as well. So thank you. Stephen was in here for vulnerable populations. He was amongst the crowd. And then we also have other dignitaries here as well, our representation from other offices. Chase, I see you in the audience. Thanks for being here with us. Those are really my remarks. I just want to say thank you so much. I mean, it takes, as you can tell, so many people to make sure that things can keep running and that we keep moving in the direction of progress. So with that, I bid you adieu and thank you.